want to welcome you to, this is our second talk of the day. Our Reach Lab it's been a very busy day. We have had 3 members of our team down in Southern California presenting on our cannabis and tobacco materials down there in various conferences. And then this is the second talk for the fentanyl and opioid awareness and overdose prevention work that we're starting. And then also we tabled today at Stanford a big fentanyl prevention event was happening on the main campus as well. So it has been quite a wonderfully busy day for the lab and trying to get our materials out to you. I'm going to go ahead and start sharing my screen and welcoming you all, and let's get this story started because I think it's important and I want to make sure that we have plenty of time. So I will introduce myself. I know many of you on this call, but if I don't know you, my name is Bonnie Halpern-Felsher. I'm a professor of pediatrics in the Division of Adolescent Medicine at Stanford University. I'm also the founder and director of our REACH lab. REACH stands for Research and Education to Empower Adolescents and Young Adults to Choose Health. So REACH. And I'm also the founder and director of all of our various curriculums, one of which, a new one that you'll be hearing about today, or a revised new one that you'll be hearing about today. So our REACH lab is a wonderful group. And I say that because I'm super honored to be able to work with this amazing team that we do research in the lab on adolescent decision-making, adolescent young adult risk behavior with a particular focus. Used to be just on tobacco, then it was tobacco and cannabis, and I'm including e-cigarettes as tobacco, and then now really all drugs, and really been pushing out more fentanyl awareness and prevention materials. This has been really important to us. And with today being Fentanyl Awareness Day, thought it was a fantastic day to launch some of our new materials and get them out to you. As I'm going through, don't worry if your camera's not working. We're so happy that you're available, but if your cameras are working, please come on board. We have a large enough group that I would say, you're welcome to shout out something, come off mute, or if I think it will work for you to do that. If not, let me know. But if it's a quick question, maybe put it in the chat, and I promise I will get to it either during the talk or towards the end. So I'm going to go ahead and get started and tell you what we're going to talk about today. So we're going to do welcome and introductions. We've already done that. I've welcomed you, said who I am. Oh, I don't think I said I'm a developmental psychologist by training. We'll tell you that. And did additional training in adolescent young adult health. So thank you for continuing your introductions in the chat. Please keep doing that. That's wonderful. So we're going to talk about why we're here with, obviously we're concerned over fentanyl use and overdose amongst youth. And when I say youth, I'm really talking about adolescents and young adults. I'm going to then spend a few minutes talking about our opioid information that we have, and then we'll talk about specifically fentanyl and why we're so concerned about fentanyl and the difference, overlapping but a little bit different concerns around opioids more generally and fentanyl specifically. And then we have 2 wonderful high school students who will come on and we'll do a little Q&A with them. And then please don't go away. We'll come back to sharing more slides to really present to you our revised fentanyl prevention curriculum that we have. And then Q&A time anywhere throughout the talk, just shoot it on the chat and I will address it. And if for some reason I can't, or if there's something going wrong, I've got Divya from my lab who is on as well, who's going to be my wingmate to add things into the chat and help as we go along. So please do keep an eye in the chat for links to some information for you. Again, I mentioned before, but just so you know, these slides will be available as well as the recording. We will send that out to you. It might not be till tonight or whenever Scott gets off the plane to give me the link. So it may be tomorrow morning, but we will be getting the resources out to you. So don't worry about that. All right, let's get going. So REACH Lab Just a quick shout out to my entire team. We're an unusual behavioral science lab at Stanford in that we have researchers, that's common, but we also have folks who are in public health. We have educators and people who work on education and curriculum. I'll show you that group specifically in a little bit, but they're also on this slide. We have a public health lawyer who's part-time in the lab. We have a full-time graphic designer, Brandon, who I think is also on this call. It's unusual for a lab to have a full-time graphic designer, but in order for us to bring the materials to you in the curriculums and infographics to make them so pretty and so amazing, we've got our graphic designer and as well as the curriculum team to make that for you. We also have a psychiatrist and an adolescent medicine specialist who are in the lab a few hours every week to help us. All right, so why are we all here? And this is important for us to remind ourselves. And I think nothing better than this quote from a recent New England Journal article that came out from one of my colleagues at Harvard, Scott Handlin, and then his colleague, Joseph Friedman, who said every week in 2022, the equivalent of a high school classroom's worth of students, an average of 22 students, died of drug overdoses in the US. Most of these contained illicit fentanyl. Fentanyl is now involved in at least 75% of adolescent overdoses. I don't think there's a better or more sombering way to start this off than that quote. So let's start with opioids, and then we'll get specifically into fentanyl. Fentanyl is a form of opioid, but why do I do this? A few different reasons why I think it's important to know about opioids more generally, and there's important information. But also, I was talking to 4 college students who work in my lab part-time last week, and they were confused about opioids versus fentanyl and said to me, well, wait a second, Bonnie, I don't understand why the concern is with fentanyl. I thought it's that people are becoming addicted to opioids and then they use too much and that's what's happening. They didn't understand that, yes, that's still true, but we're also worrying right now about drugs that are laced with fentanyl, young people buying pills online and thinking that they're getting one thing and they're getting fentanyl. They didn't make that distinction. And I think it's important for us too, when we talk to teens, when we talk to parents, when we talk to anybody, because yes, the opioid overdose epidemic was something that we are and have been very concerned with as well. But we also have this added piece, which is the illicit fentanyl. So that's why I want to start here and explain this a little bit. So you may know that there are many different kinds of opioids. We've got morphine, codeine, oxycontin or oxycodone, Vicodin, which is a lot of people have had when they've had surgery, heroin, and then fentanyl, a synthetic opioid that obviously we'll spend the majority of the time on. But there are many different kinds of opioids. And opioids are not new. They came on really to us in around 3400 BC as a class of drugs to treat pain, and they still are used today to treat pain. Most of the opioids, not fentanyl, that's a synthetic opioid, but many of the opioids come from the poppy plant. And these drugs have molecules that mimic the shape of naturally occurring opioid system neurotransmitters in the brain. And then opioids can be taken in many different ways: orally, snorted, smoked, injected with a needle or syringe. So opioids are largely used for pain relief, and they work by mimicking the body's natural pain relief system. But they can also impair judgment, physical actions like driving, and that's one of the many reasons why we're concerned about them. We're also concerned because the class of drugs of opioids are very highly addictive. And we'll talk about that a little more. And then all methods of opioid use, no matter what opioid you're using and how you're using it, have risk. And we're going to be talking a lot about the pills, but injecting is also particularly risky because if you're sharing syringes, you could be sharing infections, spreading infections. And that is true with people who are addicted to opioids, seeking more opioids, and we're seeing sometimes that they're sharing needles. So why are people using opioids? Well, people are, like I said, to relieve pain or for sedation, to make them relax, to calm them down. If they're in pain or severe pain, they might be given by a physician or another healthcare provider. They can also create feelings of euphoria, calm, or relief from anxiety. And certainly the euphoria and calm also reduce the pain that one might be having, physical pain. And they're often prescribed by a doctor during surgery, or if you've had your wisdom teeth out or were injured, broke a bone, and so on. And herein, by the way, is part of the problem with opioids more generally, not the illicit fentanyl, but with opioids more generally. A colleague of mine here at Stanford actually published a study showing that the number of adolescents and young adults who have had wisdom teeth out who are prescribed opioids, and that is a concern because, and I'm not saying that taking a couple of opioids while right after surgery is a problem. No, but the problem is that it feels good. People don't understand that feeling, and then they wind up using more and continue to use. And we are seeing just a proliferation of prescription of opioids in the United States over the last decade or so. And you probably know that there's been some opioid settlements in certain states that have sued various people who have been promoting and manufacturing the opioids because it has led to such an overdose epidemic that we're seeing. So when you take opioids, there are several effects that we worry about. It can contract your pupils, you can have loss of muscles, slurred speech, you can have nausea, constipation, suddenly fall asleep, which is also of concern if you're driving or using heavy machinery, you can have itchy skin. And then the most concern and why we're seeing people die from opioids generally and fentanyl in particular is it can slow your breathing. And then if you take too much, it can stop your breathing altogether and you die. So this is one of the biggest concerns that we worry about. So the risk of opioid use is such that the overdose is common with any and of risk with any form of opioid in any amount and can be fatal. Risk of overdose increases when opioids are mixed with other drugs. We will warn people, and teenagers in particular, not to use opioids with other drugs like alcohol. We see that often, and that's a particularly harmful set of drugs to be taking. And then the continuous use of opioids can lead to tolerance. And what does this mean? This means that you're then going to be using more, and then you're going to need more in order to get that same high or that same effect. And as you get more increased tolerance, then that could lead to physical addiction or dependence or addiction. And by increasing the use, that is where we find that people, not just young people, anybody is using too much, overdosing, and at risk of dying or death. When we talk about fentanyl, that's a little bit different with the illicit fentanyl. That's not necessarily somebody who's always seeking a drug or continuing to use. That is different. But in this case, what we're talking about here is somebody who's been exposed to opioids, wanted to seek opioids. Maybe they had it in the doctor's office, dental office, or whatever, or just decided to seek it to relieve pain, to relieve stress and anxiety. And then that continues to be a product that they use. And again, worrying about overdose and addiction and overdose. So let's talk about fentanyl specifically now. I see a question in the chat. Let me make sure. Yes. For those of you who didn't hear when you came on, first continue to introduce yourself into the chat. We love that, who you are, where you're from, what state, and what you do while you're here. But all slides and the recording will be sent out either late tonight or tomorrow morning. So fentanyl, and by the way, a lot of the slides I'm using, by the way, are just a kind of adult version of what we have in our curriculum, and I'll show you that curriculum soon, but you'll also be able to get them there. It's just those have more cool images and designs. I'm just doing it a little bit more straightforward, but not all, but a lot of the material I'm covering is in the slides. All right, so fentanyl, let's talk about specifically fentanyl. So as I said, fentanyl is a synthetic opioid. It is not from the poppy plant like many other opioids. It's one of the most potent opioids that exists. And it is approved for medical use, like pain and surgery. So there are physician prescribed fentanyl. And in this case, it's intended for treating severe pain or chronic pain, especially for patients who may have developed a tolerance to less potent opioids. The issue is illicit fentanyl. That's where we're particularly concerned. In this case, the fentanyl is produced illicitly or illegally, and that means outside of the legal regulatory system, and that it has contaminated the broader drug supply. And it's important. When we were tabling today at Stanford with the students, somebody asked, can you smell it or taste it? No, it's really difficult to detect, to smell, or to taste. And the big issue is fake pills, fentanyl pills, counterfeit pills, whatever name you want to give it. That's our biggest concern, and we'll talk about that a little bit more. But again, this is not somebody who's seeking opioids, or maybe they are seeking fentanyl, but it's the illicit fentanyl, the very, very potent fentanyl that is laced in other drugs. So let's talk about youth specifically and illicit fentanyl. So youth deaths are largely driven by the counterfeit or fake pills that are containing fentanyl. Most youth who are overdosing don't have an opioid addiction or an addiction to any drug, or might not even be misusing any drug. And in fact, most youth are unaware that the pill that they're taking contains fentanyl. Often youth are looking for Adderall, they're looking for ADD medication, they're looking for Percocet, or they're looking for some medication to help their anxiety, to help something else. And what happens is they buy online or not from a trusted person, or maybe it is a friend, but the friend didn't get it from somewhere that was safe, and that is laced with fentanyl, and that is where we're seeing the overdoses happening. So the effects of the fentanyl are pretty much the same as what I was talking about earlier with opioids, but because the drug is so potent, so strong, the effects can begin sooner but also last for a shorter period of time, but it can slow breathing and ultimately cause death. So a lethal dose of fentanyl is incredibly small, incredibly small. 2 milligrams of fentanyl, which is about 10 to 15 grains of salt, think about that, less than a pinch of salt, is considered a lethal dose. 1 kilogram of fentanyl can kill 500,000 people. The DEA, or the Drug Enforcement Agency in the US, found that counterfeit pills contain between 0.02 and 5.1 milligrams of fentanyl per tablet. Again, 2 milligrams is all you need for it to be deadly. So just to put this into perspective, and by the way, this image is on one of our pamphlets, our infographics that I'll show you those in a little bit. But when you're looking at this, if you compare a penny, think about a penny, which is pretty small, then think about a grain of rice. Look to the right here, if you can see my cursor. This is the lethal dose of fentanyl, very small. So a lethal dose of fentanyl is equivalent to less than a grain of rice. That's why it's so difficult to see, so difficult to detect, and yet so easy to get into our materials. And by the way, some people say, well, can't we just regulate and stop or arrest? I was in the California Senate and we were having this debate. Can't you just arrest or stop? People are making it illegally. The problem is it's so incredibly cheap and easy to make. People can make it in their kitchen. So, yes, you can stop one person on the street from making it, but then there's another person and another person. So that's also why we're here today is, yes, we'd like to stop the marketing, manufacturing, and distribution, but I also want to make sure that we're keeping people safe if they were to encounter fentanyl or opioids in general. So that leads us to adulteration and access. So accessing substance, and by the way, this isn't just me preaching to you. These are just giving you some information that I hope you will use to talk to your children, your students, your patients, whoever capacity that you're here today. So when we're accessing substances from the street, they can be dangerous. These are unregulated and can often contain substances like fentanyl that you didn't mean to have. So seeking a drug that anyone is unfamiliar with does not is bad. And even if you seek a drug that you are familiar with, it does not necessarily guarantee it's safe. Depends on where it comes from. So you should not obtain drugs from unknown sources, like online or from other people. Buying a drug online is very dangerous. So here's just an example here of what you might see. So on the left, imagine that you or a teenager wanted to buy, say, 2 milligrams Xanax bars to help you feel calmer. But actually, and you buy these online or you get them from a friend, you don't get them from a doctor, you don't get them from another healthcare provider, you don't get them from a reputable pharmacy. What you might be getting is Xanax that's laced with fentanyl that we see on the right. Fentanyl is deadly synthetic opioid that's 50 to 100 times stronger than morphine, and again, can cause an overdose. Now, if you look at these pictures, it's really difficult to tell that the one on the right is fake and laced with fentanyl. Now, seeing it, you could possibly tell, but if you didn't know, these fentanyls, fake pills, illicit drugs don't necessarily look obvious that they are unreal, and this is part of the problem. So we have an activity in our curriculum that you can use where students really like this. We actually have this activity not just for fentanyl, but for adulteration of any drug. It's really important that we teach young people to be careful, not to just take for granted what somebody gives them. You can buy 2 pitchers, ideally see-through. One, they could be glass or plastic. You put water in each of them. If you want to put some ice, some lemon, some mint, whatever you want in the pitchers. You fill one with salt, one with sugar, stir it up. You cannot tell which one has salt and which one has sugar. That's a great activity. It seems simple, but it really helps teens understand. And teens don't want to take the one with a lot of salt. And maybe they don't want to take a lot of sugar either. And you might get the reaction of, oh, I don't want to take that. Okay, then why are you accepting a pill or any form of a drug from somebody who's a stranger or you don't actually know what's in it? So this really helps teens stop and think. So that also brings us to our fentanyl testing. Yeah, so Cassie, great question. They are often using it as a filler because it's cheap. And that's actually why people cut drugs, period, with anything, is it's cheap, it fills it out, and allows that to be. So it's not that it may still have a little bit of the Adderall or Percocet or whatever you need. It may still have some of that, maybe not, but it's not always that the entire pill is a fentanyl pill. It is sometimes a filler or cut with it, and it's because it's cheaper. And it's just sad. It's just sad. We can do an emotion check at the end of this talk. It has definitely made me in a more sad and somber mood today. All right, so checking the substance. This is important. Now, ideally, we have students, young people, all people who know not to buy these drugs from places that's not reputable, not to get them online and so on. But we know young people are going to. We know that sometimes that's going to happen. And we also know that young people want to experiment. And as much as we can say no, N-O, which is never, by the way, if you ever hear my harm reduction talks, never a good way to talk to teens. But even if, we certainly want teens not to use drugs. But in this case, first of all, they may not be using, they may want to use drugs, and our main mission is also to keep them safe and alive. But again, a lot of the teens who are dying are not, or young adults, are not buying something that they thought that they're using drugs. They bought drugs in the illegal sense or illicit sense. They're using drugs that they thought were reputable, but they're not. So it's really important that we teach them how to check. And this is fentanyl test strips here. What's nice is with COVID, well, COVID's not nice, but the nice thing is having had COVID and all the COVID test strips, we're used to seeing a test strip like this. We're used to reading when something is positive or negative. So let's start encouraging, and you'll see I'm a big proponent of fentanyl test strips. At our tabling event today, one of our partners was giving out fentanyl test strips. We should be doing this for everybody. So this is the best way to figure out if a substance has any signs of fentanyl in there. Now, there are limits to fentanyl testing. It tests only whether there's presence or absence of fentanyl, not the amount of fentanyl. It does not detect other drugs that are used in combination with fentanyl. So if the drug is being cut with anything else, it will only detect the presence or absence of fentanyl. And it doesn't test for fentanyl analogs. The other limit is the chocolate chip cookie effect. So what is important here is, and what's happening that we see with these illicit pills is the fentanyl is often not evenly distributed in the drug, and it may, especially if it's used as a filler, may only be in one little part. So here's just an image. If you've got on the left if you have here the cookie with the pretend that the chocolate chips, or in this case fentanyl, the little dots, but what you test is this little piece here. There may not be fentanyl in there, and then you consume it and there is fentanyl. So that is one of the things that you have to be aware of. They're not perfect. Now, I'm not showing it to you here, but on our new curriculum, we have on there different ways to test given this idea. So we have where you can test a piece, where you can test the whole thing by dissolving it, and then if it's safe, you can drink it. If you still want to ingest the pill, there are different ways to test, and we have those different methods on our curriculum. Another limitation is not all states allow fentanyl testing, and Divya, I think, is already ahead of me. Thank you. Divya already put this into the chat, a link to states' laws. So please check. California does allow testing, but I know we have people across the country, which is fantastic. Please check whether your state allows it. And if your state does not allow fentanyl testing, good opportunity for some advocacy there, and we're happy to help you, because I really, really think that we should have fentanyl testing everywhere. It is not foolproof, but it is a lot better than having our young people be ill or die. So how do you recognize if an overdose is occurring? So first of all, slow, shallow, and erratic breathing. You can tell whether or not they're breathing well by just putting your finger under their nose, and you could see whether you're feeling any air going through. Pinpoint pupils, snoring or gurgling sounds, unconscious or unresponsive to stimuli. So if you rub their chest hard and they don't wake up, that is a sign that they might be having an overdose. Limp, you raise their hand and it just falls down, is another sign. Slow pulse or no pulse, great opportunity for you to teach students, particularly middle and high school students. They like learning how to take pulse. Teach them how to take the pulse, and that's a great way of knowing it. Yeah, so Michelle, let's do offline and let's talk about that. Thank you. And then pale or ashen and clammy skin. So in an event of an overdose, my other piece that I'm really advocating for is naloxone, or called Narcan, that can reverse the opioid overdose. And it is ideally carried by emergency medical technicians. I'm hoping that all of you are carrying this. I have it in my backpack. I carry it everywhere. Our lab has them. We've been trained to use it. I really hope that every school has Narcan, not just one, but multiple Narcans, that every school has it, that every library has it, every bar has it, and that each of you are carrying it. Thank you for carrying it. That's so wonderful. And Divya just listed some training resources for getting trained on using Narcan. I think more in California because that's where we're based, but look for where you have the ability to do so in your area. Wonderful, Raina. That's fantastic. Thank you. I'm so glad you guys have these. Incredibly important. I would love a bowl of Narcan and a bowl of test strips in every health center. I'm serious. We need to do this. So what's important is, if you come across a student, and this is important to talk to students, if you come across anybody, not just a student, who's unresponsive, call 911 first, period. Call 911. We'll talk about Good Samaritan laws in a second, but call 911. Then check, are they responsive? Check their airways. Then you might need to ventilate them. And then evaluate if they're not waking up, and that should be very quickly, by the way, because you want to medicate immediately. Then medicate them, put them in the recovery position on their side, which we have that in our curriculum as well to show you how to do it. use it in one nostril, and then if wait a few minutes, 5 minutes, if they don't wake up, shoot it in the other nostril. Important to tell everybody, you cannot hurt somebody by giving them Narcan if they don't have a fentanyl. Narcan only works on opioids, by the way, fentanyl and other opioids. It only reverses that effect. If somebody if they're passed out for a different reason, you've already called 911, great job. You're not hurting them. But if you are at all suspicious that they are having an opioid overdose, please use this. You can save their life. Now, what's important is you can't stop there. The reason why you call 911 is the opioid is still in their system. So you need to call 911. You need to get medical help there because it only lasts so long and they're going to need further medical care. Thank you. That's fantastic to hear that you are doing that. And hopefully some of our resources will help you further do this. Now, it's important to know about Good Samaritan laws really quickly on this, that never be afraid to call 911 or seek medical help. Now, Good Samaritan laws are also state by state specific, and Divya will throw that link into the chat as well. Please find out in your state what's allowed. Most states have fairly good Samaritan laws. California has fantastic. We're incredibly liberal here, which is wonderful in terms of this. In many states and in California, if you call 911, I don't care how old you are, if you're underage, I don't care what you have on your possession in terms of drugs, you will not be busted. I've talked to police officers about this, and they have said that that is the case. Are you going to get some who don't follow the rules? Of course. But in general, schools know, school resource officers know. They might confiscate the drugs. I'm all for that. They might confiscate the drugs, but they are not going to bust the kids. We need to tell people this because they're afraid to call 911 if there are drugs at the party or whatever. Let's just save lives. Now's not the time to yell at a bunch of kids. So just in summary for this part, and then we're going to get our young people. Annika and Richard, we'll have you come on in just a minute. So opioids versus fentanyl specifically, as I said, we need to explain the difference. Fentanyl is a form of opioid, but we're talking the most acute thing right now is the one pill, the I got a fake pill when I thought that I was getting a medication. That's the part that we're most concerned about right now. But I'm still concerned about the opioid overdoses, about addiction. I'm certainly concerned about that, but we need to understand the difference. We need to help people understand that they should not use opioids unless they've been prescribed. Do not give opioids to other people. Don't give any medication to other people, only if it's been prescribed to you. And only use them according to how the doctor told you to use it. So dose and dosage. Don't use in different places, different ways, different amounts. Be aware of ordering drugs online or getting them from someone who's unknown to you or known to you because they might be adulterated. That's really important. Any amount of non-medical use of fentanyl is harmful and can be deadly. Test strips, as well as Narcan, are key harm reduction strategies to detect the presence of fentanyl in the case of the test strips and to reverse temporarily the overdose that you're having. And if you are using, we know that young people are using. If they are, let's encourage them at least to have a trusted, sober person who can administer the Narcan in case of an overdose. So if you are a place to give out those test strips, fantastic. Still give the Narcan as well. They really should be in tandem. All right, let me stop sharing for a minute. Thank you, Richard, for coming on. Annika, are you there as well? There you are. So any quick questions before we go into our Q&A with our young people? All right. Divya, are you able to spot Annika as well? There, fantastic. All right. Richard, why don't you introduce yourself briefly, please?
Hi, my name is Richard, and I'm a current junior in high school.
Fantastic. Annika.
Hi, I'm Annika, and I'm also a junior in high school.
Fantastic. All right. So want to ask you, and I think we actually might have a time to kind of have you both answer a lot of these questions. Um, are you concerned about fentanyl and opioid overdoses? Is it talked about parents and educators in your schools? Annika, do you want to start with that question?
Yeah, sure. One thing that I've definitely observed in terms of like how it's communicated, I would say in my school, like I know that they've been trying to do a lot of different initiatives where they'll do like fentanyl or opioid overdose awareness like workshops for both parents and students, but I think up until this point, it's mostly been directed to parents. Like I'll get emails on the weekly emails that my school sends out saying that parents can attend like specific workshops and conferences where the school or like staff or county staff are supposed to provide more information on the issue. And recently we had another workshop directed towards students on fentanyl specifically, and how to use Narcan, but I can expand more on that later. But that's kind of just how my school has been introducing it to our community. I would say that I am relatively concerned about it because it's definitely something that I've been hearing about more and more recently. Like I'm on my school's journalism team and we're always like looking for local news that we can write about, especially like sometimes it'll be in the science and technology realm. So this is something that's definitely been coming up a lot. So I would say, yeah, it's a little bit concerning at this moment.
Thank you. Richard, you want to chime in?
Yeah, I believe it's a huge issue, but I honestly have the opposite experience. My school hasn't really touched base on it. Honestly, a lot of my peers, I remember the other week, some of my, maybe this is an isolated incident, but they didn't even know that Narcan was used to help fentanyl overdoses. There's just such like low education around this area, and I think that it's honestly pure negligence on my school's behalf. But yeah, I think that we need more education as even in my area, my school doesn't get it.
Thank you both. Thank you for being honest on that and giving us your thoughts there. You I think we know the answer based, and it's great. Well, it's not great to hear different perspectives in the sense that I wish Richard, your school did have training. Maybe you can now bring it to your school. By the way, both Richard and Annika, I should say, are part of our Reach Labs Youth Action Board, our Reach Lab YAB, we like to say. So we have a group of almost 40 students who work with us. And this morning in our first session, we had our two high school students chime in, and now we have our two college students, and now our two high school students. So thank you both for talking about it. But um, so Richard, clearly your school has not offered Narcan testing or training or Narcan or test strips, but Annika, tell us about that. You started saying that your school does offer and did some training. What are your thoughts on having them available at school? Do you think that they should be available?
Yeah, I definitely do think that they should be available. Like at the workshop that my school did for the students, they provided the option for students to get access to test strips and Narcan with like signed permission forms. So that's something that a lot of students actually participated in, and they got the Narcan. But we weren't like specifically educated about whether the Narcan would actually be offered after in classrooms and other areas. It was kind of just left to us to keep it in our backpacks or carry it with us. And a lot of the time, students might be forgetful and might not bring it to school or leave it somewhere. So I'm not really entirely sure on that part. I think my school could have gone into more depth into what to do in a situation where there's an overdose. I would also say that they were a little bit objective about it, the people who were presenting. It was more like they talked about it in hypothetical situations, but they didn't exactly say it. Like if this happened, like at a place that a student might be caught at, it was kind of just more like this is what you do and this is the resources that you have. But I feel like we could have had more education on how to use it specifically and what are the applications of it. But yeah, I definitely think that it's something that's super helpful to have, and I think more students should know more about how they're used, gain more access to it, and I think schools should definitely push more education that really sticks with students rather than in a presentation format, since that might not be as attention grabbing as well.
Yeah, I also want to add that like I sort of wanted to take a step further instead of not only having it available, but also like just passing it out to all the students to make it really convenient. Because I feel that like a lot of students or that I know would like walk across campus to like grab a testing strip or something. And I think that like okay, honestly, children are very lazy. So I think making it really convenient is something that we should prioritize.
I would also think then if it's at the health center or student center or whatever, and not just having to walk across, but then somebody might see that you want to take it, whether it's for yourself or maybe for a friend. I mean, often you could be using the fentanyl test strips for yourself, but the Narcan's for someone else. But we often, and in the lab, reduce the stigma and shaming that goes along, and we really work hard on that. But I think, Richard, it's a good point. If everybody had it becomes more normative, and you're not sort of outing yourself, so to speak, if if you have to walk across and get it. Is that fair?
Yeah, my school did something for period products. Like in every classroom, every teacher would have like this huge basket of it, and students can come up and grab it whenever they want. And I think that we can do something similar with testing strips.
Good, good. And somebody say that they should, yeah, that they should have Narcan stations in the hallways. I agree with you, Christina. Totally agree. Um, oh, good question. So somebody asks, have either of you ever experienced an overdose in the student body? So have you ever had somebody in your schools who have overdosed?
I can't say that I've seen or heard of anyone in my school that has overdosed. I just know that a lot of them, but just the overall like tobacco usage, but not overdose.
And
Yeah, I
it's
agree. I don't think that anyone at my school has ever had an experience like that, or I guess maybe they didn't report it if it did happen. But yeah, I think that, yeah, I agree with Richard in that I think a lot of them still do like substance usage and abuse. It's just, I don't think it's ever gotten to that extent.
yeah. No, I hear you there. But it's good to know just in case. Do you feel adequately, well, you two, it's a little biased because you're a part of the lab, but do you feel like you or people in general are adequately informed about the risks associated with fentanyl compared to other drugs?
Um, well, I feel I'm well equipped being part of this lab.
Thank you. I would hope so.
Yeah, but again, my school does not do education on it. It's not something that people really want to talk about because, again, it's a very stressful topic, I guess, that children just don't want to talk about. So it's just very something off to the side. So I can't really speak on that for my school, but yeah.
Yeah,
How
I
about
would definitely say I feel like well prepared for everything. I think like based on what Yab has taught me and also my school, I feel like I have a good amount of knowledge for what to do if I'm in this type of situation. But I would say that even though my school does do a lot of work where we get presentations on like what Narcan is, how to use it in a way, and like what kind of situations could we apply it, I feel like doing it in a presentation format might not be easy for students to retain. And especially since it was mandatory, students didn't get a choice to be there. And I feel like a lot of the time they kind of just think of it as a waste of time rather than an experience where they can learn something. Because I know that after they did do the presentation, I heard a lot more students complaining about it rather than saying it was useful. And a lot of them were even confused about what the purpose of the presentation was because the style of it was more about like it was in a way trying to reduce the stigma surrounding usage, but I think that confused students more. Like it made them wonder what the point of using Narcan is. Like they made it made them think deeper about like they thought that the people who were presenting it were in a way promoting substance use and then using Narcan as a way to say like it's okay to use it, but if it gets to a point where it's dangerous, then you have like a backup. And I think that confused students more.
So I'm actually going to ask you one more question that's in the chat, and we have about 2 more minutes. But because you all are asking fabulous questions. So one person asked, maybe just one of you can say this quickly, about having vending machines. Would that be good or not so good? Vending machines with fentanyl, with Narcan and test strips.
I think it would probably maybe depend on how it's advertised or portrayed to students. Like, if students are given more background on like what it is, like what the requirements are, and even like how to use the materials that are in the vending machine, then I think it could be an idea to consider. But I also think, like Richard was saying, like sometimes students can be a little bit more irresponsible. So maybe it would be helpful to maybe like trial run it and see how it goes.
Yeah, honestly, in my school, students don't even use the vending machines for snacks, so I'm not really sure if they'd use it for testing strips.
So one person asked, I think this is a great question. Well, what are the schools talking about when they're not talking about, Narcan or test strips? And you both touched on this a little bit, but I know that they're talking about tobacco, but is there kind of a anything in general that you're kind of hearing as the conversation they're having right now?
Honestly, it's very vague, like just drugs overall, don't do it, or like, yeah, don't use tobacco. And I also think that, sorry, this is like a long-winded answer, but I also think that like a lot of, or the health educators at my school, or it's just the PE teachers, they, or maybe the way that they're presenting it, or like their energy, but they didn't really portray it as something, a very pressing issue. They sort of like, oh yeah, just don't do that. And yeah, it just didn't feel as empowering.
So one of the comments, and we'll end with this one because everyone don't leave yet. I have a few more slides to show you. But for Annika and Richard, and kind of for one of the comments in the chat, and this was brought up in the morning as well. First of all, yes, the reinforcement of somebody saying in the chat about stigma. We need to not stigmatize and fight against the stigmatization of any drug use, of any life-saving measures, no matter what, and that's really important. But also, and somebody was saying, having Narcan, and getting some pushback. One of the other, my lab, the Reach Lab, focuses on harm reduction, with the most important piece of harm reduction being not use, not do. But if you are, let's keep you safe and alive. So, carrying Narcan and learning how to use a test strip is not encouraging young people to use. It's saying if you are using, let's keep you safe, and that's the best way. And I think that's the other thing that we have to perpetuate. That's that stereotype, or not that stereotype. That dogma is really important. Richard, on again, like 10 seconds each. Can you give a reflection on that?
Yeah, I would say I agree with that statement a lot. I think a lot of the time, like students get tired of like consistently hearing like not to do something or don't even try doing this because I think in a way it also makes you more curious as to why you shouldn't be doing that particular thing. And I think more students should be educated on more like basic safety techniques and ways to protect themselves instead of constantly being told to like not even try it because then they're in worse off situations than they would have been initially.
Yeah, I think ignoring the issue doesn't really like make doesn't wait, it's not like a out of sight, out of mind thing. It's just it's like there, and we really need to educate our children, our youth. And if they're not educated, then um overdoses happen.
Yeah, I like what one person wrote in the chat, that you tell people there's no guarantee that it'll save you, Narcan, test strips, anything, but without it, you will most likely die. And I think that that's exactly the point. Again, everyone, don't leave. I still have a few more slides, but oh, good. Somebody's ordering them on Amazon. Fantastic. Annika and Richard, thank you so much for your thoughts. There may be a little chat back and forth that you might want to look at, and feel free to add to the chat. But thank you, and you're getting some kudos, and thank you in the chat as well.
Awesome. Yeah. Hi, everybody. My name is Paul. I'm a sophomore at the University of Houston down here in Houston, Texas, and I am excited to have an opportunity to share my experiences with you all.
Great, thank you. And Yaretsi, please introduce yourself.
Hi, I'm Yaretsi. I'm an incoming freshman at Yale, and have been part of the Stanford Reach Lab Youth Action Board since 2022. And I'm super excited to talk to you guys and answer these questions.
Beautiful. So, Paul, so we have a few questions for you, and audience, please feel free to chime in. We're gonna do about 10 minutes of Q&A, and then I'm gonna go back and share a few more slides with you about our new resources. So, Paul, are you concerned about fentanyl and other opioid overdoses? Is it talked about by your university, by parents, by educators? What's your feeling on this?
Yeah, honestly, there's not much discussion going around about it, especially on campus, with my family or my friends or anything. I think maybe there's just this big stigma around it to where people like it seems so unimaginable to some of the people around me that like we wouldn't even have these discussions. Like it shouldn't even be a consideration. So there's not as much discussion going around there for me.
Does your university actually, why don't you go ahead and answer that as well, if you would?
Yeah. I think that there's definitely not as much of like people aren't as educated about fentanyl use and like counterfeit pills as they should be, but I think that in recent years I have seen more information come to light about it, but definitely not enough. Like there's still I constantly see like TikToks about people raising awareness about this because like their friends died from a counterfeit pill and stuff like that. So there definitely needs to be more awareness brought about for this.
Well, thank you both. And just the college students I was talking about the other day, who are working in our lab, in addition to you both, but were the fact that they were really confused, thinking that the whole crisis was around opioids and long-term use, and not as an acute use or one pill. So clearly we're not getting that word out, which is the goal of not only our organization, but many, many others today for Fentanyl Awareness Day. So thank you. Paul, does your university offer test strips and/or Narcan?
So I Googled a little earlier to see if any of those things were like available. There is no fentanyl resources on campus or any opioid resources that I saw. And maybe these things just aren't promoted, honestly, but as far as I know, there are no resources available.
Would you, and that's true for test strips and Narcan?
Yeah.
Would you like them to be available? What's your thoughts on that?
So I think it could be valuable for students to have those resources available. It's just a matter of there would need to be training and things of that nature for it. I think, especially for Narcan, because I don't believe students really even know what Narcan is for the most part. So,
And do you think if it was available, you or other students would use it?
I think if it was available and I had it at my disposal, not disposal, at my use, I think I could even take it outside of my school potentially and use it in the community if I saw somebody having an overdose or something of that nature. So I think it would be really valuable. This could help save a lot of lives potentially and prevent overdoses. So I think it would be helpful.
Great. We've got enough time. Yaretsi, do you want to add anything to that?
Sure. I wanted to add that I like I've seen recent like efforts to make Narcan more available. Like in Chicago, there's been like vending machines with Narcan administered throughout the city. I've seen Narcan at festivals like tents. However, adding on to what Paul said, there's I haven't seen trainings for how to administer it. So while I do think that it should be available, they're also it's tough because people needed training on how to use it. So that should be made available too.
Yeah, some of our other Youth Action Board members who are going to be on our high school students who are going to be on the afternoon session that we're doing this again. And Paul and Yuritsa, you both heard them talking about this, but for the audience, they were both saying that, or one of them was saying that they were taught, but it was so inadequate and they weren't taught what to do after administering Narcan, which is really important. So for our audience, having Narcan around, as you can tell, we're advocating for that. Other organizations are advocating for Narcan. I went to the California Senate and said we need to have Narcan in everybody's pocket, in every school, in every library, every bar. It's really important, but it's also important to help people understand how to administer it and what to do after in terms of calling 911. It's important to know that it's only temporarily blocking the response from the Narcan. You have to then call 911 and have the person evaluated because it's short-lived, the antidote basically. And so if you don't continue medication to help the young people or anybody, they can continue to relapse into the overdose. That's really important also. That's there. So do you both, and Paul, start with you for this one, feel informed about the risks associated with fentanyl compared to other drugs outside of the lab and our REACH lab? Obviously you've learned, but do you think students in general are aware of fentanyl and taking it as seriously as we adults are concerned about it?
Yeah, honestly, I'm certain that there's not as much education available for it. I mean, I think one of the things I was talking about was one of my friends' associates had um used a drug that they thought wasn't, and then they found out that it did have fentanyl in it, and they still used it not knowing these sort of harms. And so I think there's not as much information available there's information out there on like some of the harms that uh come with fentanyl, but I think there needs to be more propagation of this information to the general population so we can have access to this information.
Good. All right. Yuretsi, I think you cover this, but anything else that you've been taught or learned about Narcan and test strips?
Not outside of this organization. So like I haven't like at school, I don't think it was ever talked about like in my high school. Um I've like I talked about I've seen it at festivals and in vending machines, but I haven't seen it outside of like advocacy groups and like instructions on how to administer and what to do after. I haven't seen that.
Well, I think this is important for our audience, and I'm seeing important messages in the chat largely that it's been difficult sometimes to get the Narcan and test strips into various schools. Stanford was good about letting it in. My team and our lab, the REACH lab, are tabling at an event today in between our two webinars, getting information out about fentanyl, about test strips, about Narcan. Stanford's been open, but it's not true everywhere. And the problem is also getting high schools. And like I said, we're about to do a study or want to do a study and working with some groups about getting Narcan and fentanyl test strips into schools, into high schools and even middle schools. And somebody already put in the chat the worry about the liability. And that's been a big issue right now. And, I said this at our conference a few weeks ago, our cannabis conference, that if somebody comes in and I see them grabbing a fentanyl test strip, as a parent, as a concerned person, as a public health person, you want to grab the person and say, no, 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 if you're that worried, don't use it at all, please. But obviously that's not the case. We are having young people who are using drugs, and most important is that we need to get them testing the drug. And I'm thrilled to hear that at Stanford, we are seeing that the supply of the test strips is going down in the sense that they're using them all the time. So that's really good to know that they're taking it seriously. So I think that there's a big advocacy effort that is going on. I know Song for Charlie's been really doing that. There are other groups really working on that as well to get the word out. All right, last question for you, Yaretsi, and then Paul, if you want to chime in. What should and would you tell friends if you knew that they were using drugs? And in particular, what do you think is being safe with respect to using fentanyl or drugs? How would you talk to them? Tell me a little bit about that feeling.
I think the most important thing is the way how to approach the conversation. So approaching it with compassion and making sure it's a two-way conversation, listening, and really not judging, making sure to avoid stigmatizing and referring them to resources and harm prevention methods, letting them know that even if they're not like taking fentanyl or using opioids, that their drugs could be laced with those things. So it's important to have those harm prevention methods available. And then in regards to, you said, is fentanyl safe, or how to make it safer? Well, it's not safe, but again, like destigmatizing harm prevention methods, it's the most effective way to make it safer for the people who are at risk of being in contact with fentanyl.
Paul, anything to add there?
I mean, I think Yuretsi hit it right on the nail in terms of the harm reduction kind of being the big emphasis, and you not wanting to act as though you're demeaning them for using it, but instead seeing how you can act as like a positive something to lean on in times of need potentially, and someone who can provide the sort of information and resources that they may be looking for. So I think Yuretsi had it.
Right. There was a question in the chat just to me. Let me just see if I can read this. I think this is a question. All right. Let me just. So it's a question about the harm reduction, which we do. We advocate for harm reduction for all drugs. With not, how do you balance the harm reduction message with not misrepresenting the true social norms of how few are actually using an accurate perception of harm reduction, which are most appropriate to share with this population. Yeah. So, thinking about harm reduction, and two good questions about marijuana and vapes, as well. So let me do those quickly. And Paul and Yuretsi, we're running out of time, but if you want to quickly chime in on this, let me just say to the audience, we do believe in harm reduction in our lab, in our Reach lab, and we have harm reduction curriculums around that. The most important piece around harm reduction, the message we give is don't use, right? That's the most important. Now, when it comes to fentanyl, a lot of times people, young people, older people, are not using drugs in the stigmatized idea. They're trying to find something to help them feel better. And so when we, that's where I think the comments of the stigma are really important. And Yuretsi, you brought this up as well, that we're not trying to stigmatize, we're really destigmatizing the use. And the comment, the sentence I've been saying is, let's not normalize drug use, let's normalize drug conversations. And so having a conversation about this does not mean people are going to use it. Now, there's often the piece, and we saw this back in the days of HIV prevention that I was working on, when you say to somebody, the real chances of this happening is, 0.001. So people don't always listen. So I think it's important that we, and there's another conversation around decision making, which is the core of my research. But when we talk about decision making with young people, we don't want to scare them. We don't want to oversay it. You don't want to say if you do X, Y will automatically happen. Because if Y doesn't happen, you've lost them. They don't believe you anymore. So the conversation often is, it may not happen, but man, if it does, this is not something that we want to risk. And when we're talking about fentanyl, we don't want to risk death. And that's why it's so incredibly important to have these conversations with young people, and young people to have a conversation with each other, that we get this word out. We could talk about that more on a second go, but Yuretsi or Paul, any quick comments on the conversation around harm reduction and where that's going.
I guess I could add kind of I think it's so important to emphasize that it's not as though we're promoting drug use. It's we're promoting, I think, as you were saying, the saving people's lives. I mean, at the end of the day, this is what this is. We're trying to prevent people from dying. And I think that is so important. That is why we need these harm reduction techniques. So
Well, audience, please join me in thanking Paul and Yaritzi. Don't leave yet. I still have a few more slides I want to share. I really want to share our new curriculum, but Paul and Yaritzi, thank you so much. And thank you, audience, for your amazing questions. Let me go ahead and finish sharing my screen to just end with a few more resources that are out there. And you know, this is not just my conversation or my lab's conversation. So many of you are trying to get the voice out, get this information out. This is not, you know, the cliche, if it takes a village, it really, really, really does. I'm fortunate to have an amazing village in my Reach Lab and our youth action board. So let's talk about what you can do. So our Reach Lab has some resources in Divya. If you're not familiar with them, we'll put some of the links in the chat. Even if you are familiar with all of our resources, I should have the FREE across here, and I didn't do that. Everything we offer is free. This webinar is free. The only thing we ever charge for is our cannabis conference, but everything else that we offer is free. So realize that I'm not selling anything to you, and I really want you to be able to use these resources. So if you have used our resources, please keep coming back. We have done some major updates very recently. So this is and Divya is putting the link in the chat. There's also the QR code there. This is the link to our landing page of the Reach Lab. You'll see our research here. You can get some of our publications right here under preventions and interventions. That's where you're going to find all of our curriculums, all of our lessons, all of our free resources and materials for you. We also have more under resources. We have parent and youth information too. Please keep coming back. We are constantly updating all of these materials. I want to do a quick shout out to my curriculum team. The people that you see here are the people who predominantly bring to you a lot of all of the curriculums that we offer. So shout out to particularly these members of the team, the Reach Lab, who are just amazing. Everyone's amazing. It does take a village, and as somebody once told me, I have the best individuals in my village that anybody could ever have. And I'm not saying that just because they're listening. So in here, you can also click on this code here or put your phone up. These are all, we don't have the fentanyl on here yet. That will come on here, but we do have it for you. But you can see that we offer everything from tobacco, e-cigarette, and vaping prevention materials, cannabis. Safety First is our comprehensive drug education harm reduction curriculum. And then we have a nicotine and a cannabis self-paced or group-led alternative to suspension intervention program. So this is the one that is brand new. We just launched this yesterday. This is our fentanyl and opioid awareness and overdose prevention. We did have a version of this before, but this is now by itself, very much updated in here, and you'll see within here lots of information for you. And again, we're going to be updating this. So we have our fentanyl. I'm just checking the chat to see if there's anything. Oh, good. All right, fantastic. We CEUs. Oh, thank you, Michelle. CEUs, we don't, but we are thinking that this could be a CEU. If you think we should be doing more CEUs, let us know. We would love to help offer that as well. We didn't, you may have known, we kind of threw this together in about a week and a half because we really, really wanted to do this. You could either love or blame Divya. Divya said, Bonnie, we need to do something. I went, okay, let's do it. So we put this together, so we didn't get a chance, but we plan on offering a lot more of these kinds of webinars for you. That's kind of half training, half information. Whereas some of you know we do full training on our curriculums, and then I also give 101s on harm reduction, e-cigarettes, cannabis, and now fentanyl. But this hybrid, we're going to start doing a little more. Anyway, let me keep going because I promise to get you off of here in 3 to 4 minutes. So we do have these great infographics, fentanyl flash facts, really great. We gave these out to students today at Stanford. The RAs in the dorms were taking these. They're really great. Naloxone, we're going to put one together on testing, test strips as well. And then our new, I'm not going to show you in detail, but our new fentanyl and opioid awareness and overdose prevention lesson, again, similar to what we had before, but way better. I am so happy with this lesson. It's about, I don't know, guys, 25, 35 slides. It's about a 50-minute lesson with activities and information in there. And we're going to keep building this out. This is mostly for high school, can also use it for middle school, and definitely for colleges. Is available for you completely free. And I think Divya is putting in the chat where to get that as well for you. And then finally, this here is we try not to push out through emails all of our updates to curriculums, because you will probably get an update about every 3 days or an email, not really every week or two. So please follow us on social media. In doing that, you'll get more immediate updates and information. But again, just keep coming back. And then this is my email, but and then right here, please click on this. This will get you to sign up to our newsletters. We do send out newsletters about 4 to 5 times a year, and then we also tell you about our cannabis curriculum or cannabis conference every year as well. So I will stop there, and boy, we did it in 59 minutes. Any questions? Let me stop sharing. Any questions I can answer? Reactions, thoughts, anything? Oh, thank you, Marla. Well, that's all I have. I will stay on for a couple more minutes in case somebody wants to wait till more people hop off. If you're one who prefers a smaller group, I will stay on to answer any questions. Thank you so much. Please stay in touch. Let us know how things are going and what we could do to support you, because that's what we try to do.
Bonnie, someone asked you present in person for staff development.
So it depends on where you are. If you're local, yes. If you are not local, that's the one thing we would have to have you pay for us to do, because we don't have a travel budget for everywhere in the world. So yes, we could do that. The timing has to work. And it depends. And if I can't do it, some members of my team can. But we don't have a travel budget outside of California.
So the person's from Fremont Unified School District.
Oh, yes. Shoot me an email separately and we'll talk about it. Yes, thank you. Happy to. I can drive to Fremont. I was kind of hoping, you were living in Hawaii and we're going to give you Hawaii. We do a lot of collaboration in Hawaii. Well, please don't feel compelled to stay on if you are done, but I will stay a little bit longer in case you have any questions. Thank you all so much.
Hi, Dr. Bonnie Halpin-Felcher. It's Pisani. I'm from Staten Island. How are you?
I'm doing well. How are you?
Pretty good. So because I'm in New York, I'm actually home.
Yes.
So I'm not on camera. But I wanted to know, because we are actually going to be, I think you've had communication with my manager, Royce.
Kellyanne?
Yes.
Yes.
So is she aware of this new fentanyl opioid prevention?
She saw the email because she responded to my email that I sent out to our listserv of thousands of people. And she said, great, or yay, or I'll send it around. But I don't know if it sort of, got in that she should use it. I know that she is liking our safety first curriculum, which fentanyl is part of that, and has been happy with that. But please ask her.
Yeah, I will run it by my director. I just want to do the chain of command. I will send her the information, and then I guess she'll forward it to Kellyanne. Yeah, because
Yeah.
this, Staten Island, this is a big issue. I know it's all over, but Staten Island, the rates are high. So,
Yeah.
and being that
Yeah.
I'm there now, I figured it would be a good idea to try and, you know, have this as part of what we do.
And we're actually working on a contract with Oasis.
Perfect.
A
Okay.
lovely, lovely, nice contract, which will bring us out, some members of my team, including myself, out to different areas of New York State, and one will certainly be in the Manhattan area. So, I am happy to tack on a talk on fentanyl or anything else if I'm out there. Might as well take advantage of my time and our time. So we would love to do that.
And
Excellent.
then, Bonnie, there's another question which
Yes.
asks that the states that don't allow test strips, are there other kinds of resources?
You mean for testing?
I
Ah,
think that's where that question is going.
I don't know. Does anybody else on this call know of any other way to test fentanyl? I don't know of any other way.
Neither do I. And I think some of the states that don't have it have been advocating and trying to get bills passed that allow
Yeah, that's about the
the
best way
test
to do it.
strips.
Now, I do know that Health and Human Services, the Assistant Secretary, Admiral Levine, Rachel Levine, who is an adolescent medicine doc. So I know her well. I'm the president of the Society for Adolescent Health and Medicine. Don't congratulate me. You should be yelling at me. Why did I take that on? But I spent all of Saturday doing SAM work. But I am fortunate to get to meet with Admiral Levine quarterly. She is incredibly in favor. She won't, I doubt she'd write a letter, but she has resources online. Would it help to have somebody at the federal level, may or may not, be helpful? But she and her office and she's an adolescent medicine doc, are very, very much in favor with harm reduction, with fentanyl test strips and things. And I think some of the reason for the pushback is that people are scared that it's going to encourage use. And I'm always happy to come help and, you know, raise the data to show how wrong that is and how incredibly important it is to give life-saving measures, if that would be helpful. It's hard.
Yeah, I know we had a workshop actually where they're trying to put the test strips in schools, in high schools, I believe. Sort of like the condom of distribution, and say,
Right,
like, just because we're distributing condoms doesn't mean we're promoting sex.
right.
This is like a healthy intervention. So I think that's kind of like the push that they want to have with the fentanyl strips.
Yeah. Yeah. Well, I mean, honestly, my team's heard me say this. I would love a bowl of condoms, a bowl of naloxone, and a bowl of test strips in every school.
I agree.
But I'm not going to win that battle yet, but I'm certainly pushing hard for it. And yes, having it does not mean you're not going to encourage sex, you're not going to encourage drug use, but you're going to keep safe those who are already intending to do so. And that's what all the data say.
Absolutely.
Yeah. Thank you, Annika.
Thank you so much. Always a pleasure.
Bye.
Thank you.
Bye.
Take care, everyone. Be safe today and tomorrow.
You too. Thank you.
Thank you. Bye-bye.
Thank you. Bye.